In the heart of Philadelphia, at 3801 Lancaster Avenue, stood a nondescript building. This was no ordinary medical practice. This was the site of unspeakable horrors, a place where vulnerable women were exploited and innocent lives were extinguished. This is the story of Kermit Gosnell's abortion clinic, a chilling tale of malpractice, murder, and the failure of authorities to protect the vulnerable. For years, Kermit Gosnell operated his clinic with impunity. Behind the facade of a medical professional hid a sinister reality. Gosnell's clinic was a far cry from a legitimate medical facility. It was a place where profit trumped patient care, and basic hygiene was non-existent. Women, many of them poor and desperate, sought Gosnell's services unaware of the horrors that awaited them. They came seeking help, believing they were in the hands of a trained medical professional. Instead, they were subjected to barbaric conditions and procedures that defied medical ethics and basic human decency. Kermit Gosnell's crimes shocked the nation. The sheer brutality of his actions, coupled with the fact that they occurred over many years, left many questioning how such horrors could go unnoticed for so long. Gosnell was not just performing illegal late-term abortions, he was, according to prosecutors, killing babies who were born alive. Gosnell's weapon of choice was chillingly straightforward scissors. Prosecutors argued that he would sever the spinal cords of babies born alive during abortions. These infants, some born well past the legal limit for abortions, were treated not as patients but as medical waste. The details of these procedures, as described in court documents and witness testimonies, were deeply disturbing. Beyond the murder charges, Gosnell was also accused of involuntary manslaughter in the death of Karnamaya Mongar, a 41-year-old refugee who died of a drug overdose at his clinic. The clinic, already operating under dangerous conditions, was criminally negligent in its care of Mongar. Her death, while not directly related to the infant killings, exposed the systemic recklessness that permeated every aspect of Gosnell's practice. The trial of Kermit Gosnell was a media sensation. The gruesome details of his crimes, coupled with the scale of his operation, captivated and horrified the public. Prosecutors presented a mountain of evidence against Gosnell, including eyewitness testimony from former clinic employees, medical records, and physical evidence collected from the clinic. The defense argued that Gosnell was a scapegoat, targeted because he provided